Welcome to this lesson on first aid for kitchen burns. With consistent safety precautions, most people experience few burns in their lifetime. In the event you or a coworker is burned, this lesson will help you know the recommended steps to take. A burn involves the destruction of skin cells and sometimes the underlying structure of muscle, fascia, and bone. It occurs when these structures absorb more heat than they can dissipate. What you do for a burn in the first few minutes after it occurs can make a difference in the severity of the injury. Remember these 3 basic safety tips when you or a coworker suffers a burn injury. Cool, cover, and call. Stop the burning process. Remove the source of heat. If clothing catches on fire, stop, drop, and roll to smother the flames. Remove all clothing around the burn area. Clothing may keep in the heat and cause a deeper injury. If clothing sticks to the skin, cool the material or cut or tear around the area to preserve good skin tissue. Never remove clothing that is sticking to a burn. Pour cool water over the burned area. Keep pouring the cool water for at least 10 minutes. Never put ice or cold water on a burn, as it lowers body temperature and can make the burn worse. Remove all jewelry, belts, tight clothing, metal, etc. Remove from burned areas and around the victim's neck. Swelling of burned areas occurs immediately. Do not apply ointments, cream, or salves to wounds. Never apply butter or flour. These things may cause infection due to their oil base and can convert wounds to deeper injury, hold in heat, and worsen the burn. Also, they will have to be washed off by a physician, causing the patient additional discomfort. Cover burns with a soft, clean, dry dressing, bandage, or sheet, as directed by medical authorities. Cover the burn with a sterile gauze bandage. Don't use fluffy cotton or other material that may get lint in the wound. Wrap the gauze loosely to avoid putting pressure on the burned skin. Bandaging keeps air off the burn, reduces pain, and protects blistered skin. Cover the victim to keep him or her warm. When a burn injury occurs, notify your supervisor immediately. Call 911 when the burn covers a large area, the burn looks raw, angry, or blistered, the burn is deep, even if the person doesn't seem to feel any pain, or pain persists or is severe. Burns are considered minor, moderate, or major according to the depth and percentage of burn and also the area of the body burned. Burns covering more body surface area than an arm of the victim, or if burns are on the face, hands, neck, perineum, or feet, are always considered major and should be cared for in a special burn unit. Burns are judged by the size of the burn in relation to the whole body and by the depth of the burn injury. Different methods exist to calculate the extent or size of a burn. The most common method, which provides a quick estimate of burn size, uses the rule of nines. In this method, the body is divided into areas equaling multiples of 9% of the total body surface area. The palm of your hand, for example, is equal to about 1% of your body's surface area. For major burns, call 911 or emergency medical help. Until help arrives, follow these steps. 1. Don't remove burned clothing. However, do make sure the victim is no longer in contact with smoldering materials or exposed to smoke or heat. 2. Cool burn with cool water. Don't immerse large severe burns in cold water. Doing so could cause a drop in body temperature, hypothermia, and deterioration of blood pressure and circulation, which could result in shock. 3. Check for signs of circulation, breathing, coughing, or movement. If there is no breathing or other sign of circulation, begin CPR. 4. Elevate the burned body part or parts. Raise above heart level when possible. 5. Cover the area of the burn. Use a cool, moist, sterile bandage, clean, moist cloth, or moist towels. Additionally, treat burns that make the skin red, even without blisters, as second-degree burns. Burns may continue maturing over 24 hours. This quiz has 3 scenarios. Please click on scenario number 1 to begin. In scenario 1, Becky is working in the Wilkinson Student Center kitchen. She is wearing protective gloves, closed-toed shoes, and an apron. As she removes a pan from the steamer, hot liquid escapes the pan and pours down her leg into her stocking. What should you do? In scenario 2, Glenn is walking in the kitchen and slips on some spilled grease. To steady himself, he puts out his hand and burns the palm of his hand on the hot stove. Blisters are starting to form. What should you do? In scenario 3, Kate opens the steamer door too rapidly and forgets to turn away, and hot steam burns her face. What should you do? Use this information as a guideline only. If you have any doubt as to the severity of a burn, call 911 immediately. Click on First Degree to begin.
Skin is the largest organ of the human body. Exposure to extreme heat, radiation, electrical shock, or chemical agents can burn the skin, causing pain, blistering, and in severe cases, irreversible damage. The epidermis is the outermost layer of the skin, and the dermis is the middle layer, with the subcutaneous tissue lying beneath. Burns are classified as first, second, or third degree burns depending on the amount and depth of tissue damage. A first degree burn causes damage to the epidermis, causing pain, redness, and some swelling. Typically, this type of burn will heal without scarring. A second degree burn causes damage to the epidermis and the dermis, and this burn usually results in pain, redness, and blistering. Third degree burns are the most severe because the damage extends past the upper layers of the skin to the sensitive subcutaneous tissue, destroying nerves, blood vessels, and other dermal components. Extensive third degree burns can be fatal because the threat of infection is extremely high. In fact, bacterial infection is the leading cause of death in burn victims.
To review, burns are categorized by the depth and percentage of burn and also the area of the body burned. Indications of a first-degree burn are minor damage to the skin, similar to sunburn. Skin is dry without blisters. Color is pink to red. It is painful, and it generally heals in 3 to 5 days with no scarring. Second-degree burns look similar to the first-degree burns. However, the damage is now severe enough to cause blistering of the skin, and the pain is usually somewhat more intense. The skin is moist, wet, and weeping. Blisters are present. There is significant swelling or edema. The color is bright pink to cherry red and is very painful. This will generally heal in 10 to 21 days. In third-degree burns, the damage has progressed to the point of skin death. The skin is typically white and without sensation. Third-degree burns destroy all layers of the skin. This may include fat, muscle, and bone. Charred veins may be present. The color may be very bright red or dry and leathery, charred, waxy, white, tan, or brown. The person is unable to feel touch in areas of the injury. This may require skin grafting for healing. Remember, if in any doubt, call 911. Always notify your supervisor immediately. Remember these steps: cool, cover, and call. Immediate care of a burn injury should always include cooling all burns with tepid to cool water, regardless of degree. Continue flushing the area for at least 10 minutes, but not more than 20. This will reduce tissue damage and pain. This is useful for up to 3 hours after the burn. Never apply ice, ointments, butter, or other home remedies. Remove all clothing or garments to reduce the contact time with hot items. Cover the affected areas with a clean, dry cloth, towel, or blanket to protect the burn and minimize pain. Call 911 if burn covers a large area, is larger than the victim's hand size, if the victim is a child or an elderly person. Congratulations! You have completed this training.